Chapter 29, Sexual Disorders. The physical dimension of sexuality includes anatomy and physiology, the characteristics that define us as men or women. Sexuality in the emotional and intellectual dimensions encompasses thoughts, beliefs, and values about sex. Sexuality and its expressions are social in nature. Cultures have an influence on sexuality. All societies have laws, rules, or customs that regulate sexual behavior. The attitudes, beliefs, and rituals help define what is appropriate sexually. Religious institutions also have a strong impact on views of what is right or wrong related to sexual behavior. Sexuality involves both sexual drive and activity. The accepted norms of sexual behavior and attitudes vary greatly within and among various cultures and societies. There is a various spectrum of sexual behaviors. Physically and mentally normal sexual behaviors are usually between two consenting adults for pleasure and mutual gratification. Some sexual behaviors produce anxiety due to self-depreciation and society's judgment of the behaviors. Sexual dysfunctions will involve faulty or inadequate sexual responses. The far end of the sexual continuum has behaviors that may involve minors, violence, force, or a lack of consent. Babies and children in the United States are treated differently based on their sex. Females are routinely dressed in pink and males in blue. Females are considered as delicate and males are not considered as delicate. 2- and 3-year-olds can routinely differentiate who is a boy and who is a girl, but most do not understand that they will grow up to be a man or woman. Until the children enter 1st or 2nd grade, they do not realize that their sex is not going to change. As the adolescents approach their mid-teen years, their peers and their family expect them to start dating. An adolescent begins to accept theirself as a sexual object. They will start to experiment socially and become sexually active. When most people had their first sexual experience in 1950s was when they got married. Although premarital sex occurred, it was considered as taboo in the 50s. Today, many adolescents have their first sexual experience by the time they are 16 or 17 years old. There are consequences of having multiple sex partners and serial relationships. There can be mental instability, disease, unwanted or unplanned pregnancy, jealousy, financial problems, and single parenthood. The potential problems associated with women having babies in their 40s or 50s is the potential for abnormalities within the child, a higher incidence of miscarriage, a high-risk pregnancy, financial burden of procedures that are involved, and dying before the child is grown into adulthood. Older adults may just be interested in sexual activity as well as younger adults. Nurses that work in a nursing home and other facilities that care for older adults can attest to the fact that older adults still are sexually active. Intercourse would not be desirable or impossible in later adulthood due to medical problems, poor endurance, medical side effects, pain, vaginal dryness, lack of interest, or disabilities. Many permanently disabled individuals are able to enjoy both rich and satisfying sexual lives with some adaptation. Any condition that affects an individual's well-being, mobility, or self-esteem affects the expression of one's sexuality. Health problems like diabetes, arthritis, and cancer also have an impact. Individuals who are disabled learn to adapt to their conditions. Most are able to cope with negative attitudes and the stigma toward disabled people. Individuals with disabilities have the exact same needs as everyone else in society. Improving the quality of life for individuals with disabilities involves changing the social attitudes that limit the disabled population. Heterosexuality is sexual desire or preference for members of an opposite gender. Homosexuality is a sexual desire or preference for members of the same gender. There are also asexual homosexuals. With bisexuality, individuals are sexually attracted to both men and women. Transgender individuals, their gender identity and expressions are different from the individual's assigned sex at birth. These individuals may opt for gender reassignment that can be accomplished through hormonal therapy and surgery. Transvestism is the practice of dressing in clothes of the opposite gender. This is also known as cross-dressing. Not all transvestites are homosexuals. Many are married to an individual of the opposite sex. Paraphilia is a sexual preference or obsession with objects or situations that are not normally arousing. These are considered socially undesirable behaviors or disorders. Psychoanalytic theories believe that problems arise early in life because of the child's Oedipus or Electra complex. This is where children experience sexual feelings for the opposite gender parent and resent the same gender parent. Behavioral theories believe that learning states that individuals are introduced to certain sexual variation by an accidental experience that is sexually stimulating. When other sexual experiences lead to feelings of inadequacy, the pleasurable accident experience encourages the continued use of the sexual variation. The four stages of sexual excitement and pleasure are appetite, excitement, orgasm, and resolution. Sexual aversion disorder is an active avoidance of sexual contact. This reacts to sexual opportunity with anxiety, fear, or disgust. Female sexual arousal or interest disorder. This is an absence in sexual fantasies and desire for sexual activity. This is the inability to attain or maintain sexual excitement during sexual activity, and they have little sexual arousal. Male erectile disorder. This is when an individual is unable to attain or maintain adequate erection during sexual activity. Female male orgasm disorder. This is a delay in or an absence of orgasm following normal excitement. Premature ejaculation. This is ejaculation that occurs with minimal stimulation before the person wants it to occur. Delayed ejaculation is marked delay in frequency or an absence of ejaculation. Genitopelvic pain or penetration disorder. This is pain or anxiety that is associated with sexual intercourse. May occur in either gender, and it may be associated with tightening of the pelvic floor muscles. Sexual dysfunction may be caused by a medical condition. This is when significant sexual problems are due to some medical disorder. It can take as long as 2 years for an individual to achieve a gender change. Exhibitionism is intense, sexual arousing fantasies, urges, or behaviors that involve exposing of the individual's genitals to an unsuspecting stranger. Fetishism is the utilization of objects, panties, for example, for purposes of sexual arousal. Frotteurism is the focus of the person's sexual urges related to touching or rubbing the genitals against the body of a non-consenting, unfamiliar person. Pedophilia is fondling or other types of sexual activity with prepubescent children. Usually these children are under the age of 13 and have not yet developed secondary sexual characteristics. Sexual masochism is sexual arousal that is achieved by receiving pain or being made to suffer, being humiliated. Sexual sadism is sexual arousal that is achieved by inflicting pain or humiliation on another individual. Voyeurism is sexual arousal that is achieved by observing unsuspecting individuals that are naked in the act of disrobing or engaging in sexual activity. There are other uncommon paraphilias that do not meet the criteria for the above categories. One is telephone scatologia. This is using the obscene phone calling or 900 sex lines. Necrophilia, sexual activity with corpses. Zoophilia, sexual activity with animals. There are multiple different associative disorders that do not fit into the above categories. Psychosexual disorders. There is a tendency to overuse or misuse the diagnosis to cover up having multiple affairs, which is different than having an actual sexual addiction. The consequences of having a sexual addiction can include the loss of family and marriage, loss of work and social relationships, poor job performance, increased risk for sexually transmitted diseases. There are signs of sexual addiction: an excessive preoccupation with sexual thoughts or behaviors that continue despite severe consequences, the inability of the individual to stop, the individual persistently engages in high-risk behaviors, there are ongoing attempts to limit or stop behaviors, sexual behavior is the primary coping strategy, there are experiences in severe mood changes around sexual activities. The individual may reduce or eliminate vital social, occupational, and recreational activities. Treatment should be sought for a sexual disorder, and it depends on the cause, the distressing signs and symptoms, as well as the type of the disorder. A basic sexual health history includes the 5 P's: partners, practices, protection from sexually transmitted diseases, past history of sexually transmitted diseases, and prevention of pregnancy.